Welcome back to AM Northwest. A smile conveys confidence and joy. But it's hard to smile when your teeth aren't looking their best. Here to share how implant dentures could be just what you need, we welcome back from Sleep Dentistry Defined, Dr. Lampee. Good to see you again, doctor.
Thank you so much.
Let's talk about a patient that you have, Lisa. She had to go through surgery and it really affected her teeth.
Yes, that's right. So a lot of the patients that come and see me, they've had bariatric surgery, which is, somebody is considerably overweight and they want to lose weight quickly, they'll have a bariatric surgery where a GI surgeon will tie off part of their stomach or even excise part of their stomach. But what happens afterwards a lot of the time is the patient, after the stomach is healing, there's a lot of vomiting involved, there's a lot of acid reflux, so their teeth all of a sudden get constantly bathed in acid, which over time will really weaken them.
And you say that because implant dentures are around now, people don't need to worry about losing their teeth.
Well, that's right. Well, if for some reason the acids after bariatric surgery really harm the teeth, sometimes we do need to take them out. But what we can do is we'll actually place implants. We can do 4 implants on the bottom. We'll do 4 to 6 implants on the top, and we can do our snap-in implant dentures that look amazing, that aren't going to decay, that are going to basically allow the person to have a normal life again, a nice smile, and they can function. They can eat pretty much what they want.
Look at this.
Lisa's before and after is amazing. We finished this case just a couple months ago, and it was one of my favorite before and afters last year because of how much change she had, not only in the quality of her health from getting the diseased teeth out, but also just her smile afterward is radiant.
Do you have to worry about them falling out at all?
You really don't. The snaps that we put in there are extremely strong, and a lot of times to get them out, we have to pull really, really hard. So,
tell us what we're looking at here.
So you're looking at an upper arch right there, and there's actually 6 implants in there that we put in there, and the new implant denture will actually snap into those like a really, really strong button.
Wow.
And so unlike an old denture, it doesn't have any plastic on the roof of the mouth, so you can talk better, you can taste your food better, you can sense temperature. It's a lot more streamlined. It's very 21st century, and it's extremely strong.
Are these recommended for people who've gone through like gum disease?
A lot of the patients also have had a lot of gum disease as well, and gum disease is where all the bone around the teeth dissolves away and the teeth aren't good anymore, and they're just very diseased. So we take them out, we put implants in, and we can do the same exact thing as well for gum disease patients.
Okay, and how young are patients at times to get these?
I've started to see a string of patients in their late 20s and early 30s.
Wow.
They've been dealing with a lot of autoimmune disorders, acid reflux. There's even some of my patients who are getting over drug abuse, and finishing their teeth is kind of their last thing on the road.
Help them feel better.
Yeah, for recovery.
What's the process? Like, how long does it take?
So with Lisa, we started last fall, and we actually did the surgery in 1 day, so got all the teeth out, put in 10 implants in 1 day. She left with new teeth in there. Now, she had a temporary set of teeth in there for about 5 months because we wanted the implants to really fuse to the bone before we started snapping them in.
I see.
It takes time for everything to heal.
Right.
And if there's extra soft bone in the jaw, sometimes we need a little bit extra time. So it took about 6 months or so. But there was one big day of surgery, and then 6 months later there was a day where we connected everything, did all the snaps and all that.
And the sedation helps with their comfort, right?
Oh yes. For a lot of these cases, they're very, very complex. They take a lot of time, they take a lot of focus. We want to make sure our patients are safe. So oftentimes we use an anesthesiologist at the office who does general anesthesia for the big cases. So
that way they're comfortable.
Comfortable, don't really remember anything.
Well, it's really a good thing.
Dentistry's a lot better that way.
Yeah, it really is. We want to tell folks, if you'd like to find out more, you can contact Sleep Dentistry Defined. We'll put the information on our website. Also give you their number, 503-646-2273.